Thank you. The hospital's quiet still. It's we have 4 patients in the COVID ward this morning. I'll just give you a brief flavour of what we're doing in the hospital. We're continuing to work up plans for how we would expand if we became overwhelmed, and we've got plans to a pretty good state of readiness for that, I think. We're working on whether we can start doing a few more outpatients that need to be seen face to face. We've been doing a lot of there's been a lot of virtual consultations going on, remote consultations by telephone or video link, but some people do need to be seen face to face, and we're working with public health on how we can do that in a manner that's safe for everybody involved and doesn't risk the public. So we hope to be able to do a few more outpatient consultations safely soon. And similarly in theatres, throughout this time the operating theatres have been doing urgent cases. There's still caesarean sections that need doing, people with cancer who need surgery. So that's all been going on in the background. You can imagine with the COVID-19 precautions we have to take, it's been really slow throughput in theatres, and work that you might get through in a morning normally is taking all day, because we have to clean the theatre completely between cases and make sure that one patient's out and before that can happen. So we're looking at how we can increase our theatre throughput again, because there's people who need operations. So we're working on both of those. I want to answer a question that some people have written to me about, and that's about why have people been dying in care homes when the hospital's been so quiet? And I think it's a really good question, actually, and it's not intuitive, perhaps. So the reason for that is that everybody who we think will benefit from being in hospital gets admitted to hospital. But sometimes when people reach the end of life, it's just not in their interest to move them around the island in an ambulance to somewhere that they're unfamiliar with and away from their home. It's just not compassionate. So we've been doing everything we can to support people in that position to have a dignified and compassionate death in the place that they're familiar with, and that's the reason for that. With the care homes, Care Home 1, we're working really hard with them to ensure that home, we would like to declare it a COVID-free place as soon as we can. So we're working really hard on that. We're doing lots more testing of staff and individuals in the home. We need a certain number of days of negative testings confirmed before we can say that. But as soon as we can, we'll tell you that. And there's encouraging evidence that a number of people in that home are recovering from the positive tests that they've had. So watch this space on that. Finally, from me, we've had a significant delivery of surgical face masks, which was our sort of tight spot for PPE, our tightest spot for PPE, and I'd just like to say a big thank you to Christopher Martin and a dental practice in Jersey that helped us source a significant number of masks that have arrived now, and we're really grateful for that. So that's me.
Before I pass over to Paul, just picking up on one of the first comments you made there, and perhaps you and Nikki could answer it between you. You explained that you're continuing to look at the capacity in the hospital and planning for more cases, and not wishing to be overwhelmed. Could you just speak for a moment as to why that's necessary in the context of no new positives today, falling number of active cases, and why it's still necessary to be doing that planning?
Yes, Nikki will speak for public health on this, but in my mind we have to be prepared for a second wave should we get one, and to not use this time to best effect should we get a second wave of COVID would be negligent. So we're doing all the preparation, and we will get that place as ready as we possibly can for the worst case, and we'll all have our fingers crossed that we never get that. Nikki?
Yeah, I think that's absolutely right, is that we've always said that we will tackle this pandemic from multiple points, and that our mainstay would be testing, quarantining and contact tracing, but we also needed to have the facility to look after people within a hospital environment if the pandemic got out of control locally. And I think it's really important that we're doing really well, but we're not going to just sit back and relax now. We're redoubling our efforts. We want to keep it contained locally, but we also want to make sure that should it not be contained, we've got the facilities to care for islanders. So it's the combination of the two, and we've always worked on that, haven't we?
Great, excellent.